A pleasant day to everyone, wherever you are joining us virtually for the second day of APPIS 2022. Let me introduce myself. I am Rod Padua. I am the co-chair and Asia Pacific representative for the Chronic Myeloid Leukemia Advocates Network, or CMLAN. In my home base, the Philippines, I am the president of Touch by Max, a CML patient advocacy group. But more importantly, I am a full-time caregiver to my son, Maverick, who had CML when he was 9 years old. He is now 23, and we are both trying to live normal lives. Yesterday, day one of APPIS was jam-packed full of information, experiences, and inspiration. We had 387 delegates from 213 patient advocacy groups in 44 countries. Wow. So what are some takeaways? From my notes, Esther Wang, in her keynote speech, mentioned Joy Tingle and Rabbit Race. She talked about basically the psychology of children patients and looking at complicated problems from the eyes of a child. I like what she said, that health literacy is not only to inform, but to empower. Richard Vines and Ranjit Kaur asked the questions: are we supposed to learn the medical language, or are the medical people supposed to talk to us in layman's words? And these questions were strengthened when we had the poll, and the number one barrier came out to be the high use of medical sophisticated terms by healthcare professionals. So what are some suggested solutions during the session of Vines and Kerr? Understanding that not every physician will have the time nor the patience to explain things. This is where the patient advocacy groups can come into the picture. Also, patients and caregivers must be empowered with the necessary knowledge and education to participate productively in this long journey. And then we come to Emily Isham's experience with her son having leukemia. It was an emotional one. So thank you, Emily, for sharing. Emily mentioned a steep learning curve, from emotional physical exhaustion to losing friends, to properly communicating, to necessary distractions, and again, to education, and the importance to the right source of information. She ended it with, I think, words to live by: live each moment, focus on small joys and comforts. Very true, especially in these pandemic times. Wi-Fi Low showed us how colors, the right cover, the positive tone of the language can make a publication be powerful, be patient-friendly, like her message of hope for breast cancer patients. Personally, it is the first time I saw a poll with a 100% result for one choice and zero for the other. When the question was asked if you'd rather read a medical book or a publication such as Message of Hope. And lastly, of course, we had 5 breakaway groups, of which 3 hubs, in the interest of time: India, Greater China, and Middle East Africa, were able to present their outputs in the plenary. Which leads me to the screen right now for a more formal document of day one's recap. It shows basically what health literacy means. It means empowering every stakeholder with credible information which can be accessed, understood, and acted upon. Key challenge for patients is like what we said earlier, the medical jargons used by the healthcare professionals, what to remember in developing health literacy tools, which we will continue for today, understanding the person beyond the patient, accessibility across demographics, and develop solutions which lead to behavioral change. Another is our role in improving health literacy, actively develop tools to improve our own health literacy. And the HCP's role, their own role in improving health literacy, which is to guide us, the patients and caregivers, to credible sources, such as patient groups who can supplement information when they lack time. And finally, patients' role in improving health literacy. Again, the verb actively ask questions to their HCPs to understand their condition. Before we ended yesterday, and as a segue to today's theme, a temperature check was made amongst us, if you remember, regarding HPS or health policy shaping. So let me show the results. This was done just before we ended yesterday. And the question was, as a patient organization, patient and or caregiver, how involved do you feel in shaping health policies in your country? If I were to, digest and analyze this graph, it would seem that the majority is in the yellow portion, the somewhat involved with 41%, and tied on second place are moderately involved and minimally involved, the light green and the pink portions. But if you come to think of it, and if you would count your toes and fingers, 16 plus 19 plus 41 right there at the top, it almost constitute around almost 3/4% of all the attendees yesterday, which is a very good sign, meaning to some degree we are involved already in health policy shaping. But then again, for today, there would be some challenges. And would this be the red one, the not involved at all? Will this be pockets of concern? And also, on the other end of the spectrum, the highly involved, the green portion, the green countries, the green PAGs, would they be prime examples of best practices? That we will know today. Day 2 is all about policy shaping, highlighting the needs to address knowledge gaps and how the case study presentations for the middle of the afternoon can help drive inspiration for real-world action to include or amplify the patient's voice in policy making. It is now my pleasure to introduce Iris Zemzoum. She is the head of Novartis Pharmaceuticals for the Asia Pacific, Middle East, and Africa regions. She will tell us more on today's theme, health policy shaping. Iris is a medical doctor and spent over a decade on the front lines of healthcare in the field of obstetrics and gynecology before joining the industry. That's it for me now, and I will turn it over to Iris. Iris?
Hello, everyone, and welcome back to day 2 of the 2022 Alliance and Partnerships for Patient Innovation and Solutions Summit. My name is Iris Zemzoum, and I am head of the Novartis Pharmaceutical business for the Asia Pacific, Middle East, and Africa region. I'm very excited about today's topic of health policy shaping, such an important responsibility that can help to broaden access to quality healthcare and treatment. Before joining the industry, I myself have spent many years working on the front lines of care as a physician. And the job of a doctor is, of course, to find a solution to problems a patient is facing by diagnosing and treating them. But the job of a doctor is also much more than that. Listening to the patient is the key. Without really listening, it is much more difficult and much slower to diagnose and treat a patient and ensure the best outcome for them. That has influenced my view of bringing patient voices into health policy shaping. Patients, caregivers, and patient organizations bring so much expertise from their experience of conditions and the challenges they faced, as well as the ability to create solutions. So involvement of patient voices into meaningful health policy shaping is therefore so critical and invaluable. I like to think about it like Dr. Prabhat Singh said, we spend a lot of time building a bridge, but not enough time thinking about the people who will actually cross that bridge. I always challenge myself and also my team to think about and consult the patient who will use our treatments and programs. And similarly, my hope is that committees and bodies creating health policies consider much more and involve those who will be impacted by these policies. So patients. Across Asia, Pacific, Middle East, and Africa, we have a diverse landscape of healthcare frameworks and access levels, and we also face a broad range of disease burdens like neglected tropical diseases, cancer, diabetes, respiratory diseases, just to name a few. And of course, cardiovascular diseases, which account for most non-communicable diseases deaths globally. And here, the urgency to address cardiovascular diseases in this region continues to grow as population growth and aging threaten to double the cardiovascular diseases burden by 2050. This makes for a public health issue that is often underestimated by the public and the policymakers. I believe we have a unique opportunity to elevate the patient voice and drive meaningful improvements in healthcare in our region. But I know that we at Novartis cannot do this alone. This is where multi-stakeholder partnerships with patient groups, experts, policymakers can create new possibilities for patients. Thank you once again for joining us for the 2022 APPIS Summit. I hope you will enjoy today's discussion around health policy shaping, and I look forward to new and continued collaborations with you. Thank you.
Thank you, Iris.